you. And
All right, good afternoon, Fresno. My name is Ahmad Barami. I'm a division manager here at Fresno County Department of Behavioral Health, and you are joining us for our public hearing related to 3 of Fresno County's innovation plans. So what I'm going to do is give you just a quick overview of what we're going to be doing with regard to this public hearing. Luckily for us, we started doing some of our public hearings and community planning process virtually last fall. So we've got a little bit of experience in terms of doing these. And so hopefully we'll be able to get through this without a snag. What we're going to do is kind of explain to you what that public comment process is. We're going to go over our 3 innovation plans, explain to you a little bit about why we had the public comment. We're going to then have a portion where I'll allow you guys to submit questions or if you need clarification. We do ask for you to hold the questions till we get to that segment because we do have staff that'll be manning and being able to not only respond to your questions, but we'll be able to see them on the screen, and then I will do my best to try to respond to those on camera as live as we can. And there'll be the part where I will tell you when we're to the public comment section, and that's really the part where we want to focus on the steps leading up to that are going to be more just information so you have a context for the conversation. I do want to remind everyone, so we're going to be plugging this in throughout our presentation, but want to emphasize as much as possible for people to stay safe, stay clean, stay home if you're not feeling well, stay home if you don't have a reason to be outside. Again, this is one reason why we're doing this virtually, so allow as many people that are interested in participating without having to leave the house, without having to be in place. We have most of our team that's supporting this process right now doing it from home virtually. So really want to make sure we focus on that. So real quickly, the public comment is a regulatory requirement for any MHSA plans, annual updates, or changes to the said Mental Health Service Act plans. As these are 3 new plans, we need to go through public comment, but we were fortunate to be able to have them line up and do the 30-day public comment period, and now having this hearing and hopefully submitting these all together to the Mental Health Services Oversight and Accountability Commission to approve in May. So the public comment is we post the plans for 30 days, allows our community stakeholders, anyone residing in Fresno that has an interest in the plans, to review the plans, provide any feedback, ask questions, and make sure that what we're putting forth is actually something that is supported by the public and came out of our various stakeholder process. The 3 plans that we presented have been in the current MHSA 3-year plan, the 2017 through 2020 MHSA 3-year plan. So these are not new. These are just things that have taken a long time for us to be able to get up and running. Fresno County at one point had completed all its innovation plans and had not put forth any new plans. And so we went from having 0 to now 3 fairly large plans. These plans are part of our AB 114 plan, which was legislation requiring counties to spend to allocate or commit unspent money from years past into projects. Again, because we haven't had a plan, innovation plans for a few years, that money kind of sat there and lingered. And so part of our plan with the AB 114 was to move forward these innovation projects. Innovation projects are not they're not startup projects. And innovation, I think, is a misnomer because I think a lot of times people think if they're doing something innovative that would be sufficient. There's very clear regulations and guidelines for what constitutes an innovation plan. So innovation plans are really, if you think about it, instead of innovation plans, are learning plans. What can we learn? What can we pilot? What can we adapt? What's something that's being done maybe in another part of the state or in another part of the country that we think could work? What are things that we can learn more about? So those are really innovation plans. The 3 innovation plans that we're going to dive into are actually plans that Fresno County, like I said, has had in its existing MHSA 3-year plan. It has just taken us some time to do it. We began work on these plans November of last year, so November of 2018. And it's taken a full year with some delays to get these up and running because in addition to having what was already in the plans, we did need to go out and still do some stakeholder connections, getting some input, really start working on the designs, getting the OAC approval on concept papers, researching and seeing if there's anything similar to what we're proposing out there. How would our projects be different? And then, the actual writing of the plan. So now we've come to the point where we've put it out for the public comment. We're having this public hearing that we're required to. We'll have one more step of having our local behavioral health board review the plan and give us the green light. And after that, this plan will be submitted. Hopefully, if all goes well, I'm knocking on wood. You can't see the table, but there's wood down here, for getting it to them by April 10th so that it can be approved, hopefully, by the commission in May. The challenges right now is if these plans are not approved before the end of this fiscal year, we do have that money that would be subject to reversion, basically meaning that money would go back to the state. And right now we're talking about $6 million, and with everything that's going on, it would just be hard to figure out, would you get that money back? How would it come back? So, and we've invested a lot of time in developing these projects for our stakeholders, for our community, with your guys' input. These plans have all been developed through and with community stakeholder input, both in the annual updates, in the MHSA 3-year plans, and then as we went through in trying to do some of the program designs. So I'll talk a little bit about what we did in each of those. You see the dates on my slides, hopefully, of when the public comment started. The public comment ended yesterday. Today we're having this virtual hearing, so I'm going to ask you if you have questions or comments to please submit those through the chat box on the YouTube. You can also email questions or comments to mhsa@fresnocountyca.gov. If you go to our website, just on your browser, type in www.fresnomhsa.com. It'll take you to our MHSA page. And if you scroll down a little bit, you're going to see not just the plans, but where we have public comment cards in Spanish, English, and Hmong. We ask if you've got not questions, but more so comments or some input, to utilize those comment cards, fill those out, and email them to us at mhsa@fresnocountyca.gov so that we can have a record of those. Those can be included in there, and then we can also make sure that we address any of those inputs or concerns or suggestions in the plan. So ask you guys to do that. That's something that you could be doing right now if you already have a question that you're thinking about, or something that you've already observed from reading the plan and you've not already submitted comments. Please use the public comment card and email those until we get to the section for public comment. So I'm going to go to the next slide. And the next slide is going to be a review of the actual one of our actual innovation plans. So this particular plan is the lodge. It is our largest plan in both the I would say in what is being budgeted for, but also in terms of its impact that it could have in terms of learning, and also just in the lifting of taking it. It is a pretty large project. The lodge is intended to really look at not housing and not shelter and not just addressing homelessness, but really trying to understand if we try to address engagement for individuals who are homeless or at risk of homelessness, who have a serious mental illness and or a co-occurring disorder, who have been, we'll say, in the pre-contemplation stage, but in, I guess, layman's terms, would be the ones that have kind of been resistant to engaging in services, the ones that have chosen not to go into programs or participate, the ones who primarily their contact with the mental health system is through jails, law enforcement contact, emergency rooms, and hospitalizations. Those are the ones we really wanted to figure out, how do we better serve and engage? Because if we can understand that, we can apply that to a lot of our other homelessness and housing programs. So this program is looking at really how does using a temporary, almost zero barrier access to shelter, so it's kind of a come as you are, play a role, really focusing on Maslow's hierarchy of needs, because if you are familiar with Maslow's hierarchy of needs, it's hard for a person to really get to the stage where they can make really sound decisions about their own wellness and future if their basic needs are not met, if they're not satiated, if they're not warm, if they're not cool. Summers in Fresno, if they don't have a place to stay. It's kind of hard to get someone to start thinking about their future. And so we're looking at, could we address those basic needs first in the lodge and then see how we can engage in there. What also makes this a little bit of adds to that innovative component is we really are looking at how utilizing peers, individuals who themselves have had experience either with homelessness or serious mental illness, that could engage individuals in a 24/7 setting, utilizing motivational interviewing, because you never know when a person's going to have that epiphany or when that light's going to go on. So being able to have that engagement with peers does that change and improve. And if it's successful, then it gives us really another formula that we can use in trying to engage our homeless individuals in general, but also individuals that have been traditionally non-engaged or who have opted not to participate in a lot of services and resources. This project is about $4.2 million over 3 years. The county has issued a request for proposals for this project. It has completed that process. It has not finalized awarding a intent to award yet, but it should be able to do that pretty soon. And that would ensure that once this project is approved, we would be able to start that work with a contractor or a vendor that would have the place that has addressed some of our staffing concerns and needs, that can really implement this project the way it was written and will be approved by the OAC. The other thing that I probably should have touched on a little earlier is every one of our innovation plans per regulatory requirements are required to have a evaluation component. So some of that $4.2 million that we talk about, it also goes to administrative costs, goes to providing the direct service, but also goes to the evaluation component as well. And in Fresno, we try to contract with third-party, independent party evaluators that have the expertise in doing evaluations, but also it removes any conflict of interest by having a third party that's seeking solely to, evaluate the program, whether it works or not works. And so that would really help us get some vital information, knowing what worked and didn't work in this project that we can replicate. Innovation programs, as we've said in our community planning process, if you've been a part of those, are probably one of the only times where you can really test a project, and if it doesn't work, it's okay, because if it doesn't, for example, if for some reason the lodge didn't work or portions of it didn't work, in and itself would provide us with a lot of learning, not just within Fresno County, but throughout the state in terms of, hey, what can you do differently next time? What are things that you can take away, lessons learned? So that's a big project, peer-driven, addressing basic needs, low to zero barrier shelter, temporary, and really looking at how do we engage people and can we learn some maybe new strategies and ways of helping our homeless population statewide. So that is the lodge. I'm now going to go to the second plan. The second innovation plan, the Handle with Care Plus, is a adaptation of the Handle with Care model. So some of you may be familiar with the Handle with Care model. It is a project and a program that is implemented in some counties and some schools, which has first responders of some way, shape, or form informing schools without a lot of details that a student may have been involved in some type of traumatic or life-changing event. And as a result, for the school to just be aware and to monitor the student. They don't go into what it was, how the student may be impacted, but that's where the Handle with Care term comes from, that the school knows to handle that particular student with care. To understand this student may be tired and why they're all of a sudden sleeping in class. Understanding that the student may have had something traumatic experience and why there may be all of a sudden some changes in their behavior and mood. Or even a student that maybe was really doing well academically and all of a sudden there's a sudden change in that. That notification to the school allows them to be able to intervene and monitor that student sooner before things get too far along. So we are looking at taking that Handle with Care Plus model and piloting it in Fresno. This project we're looking at do in collaboration, partnership with the Fresno Police Chaplaincy, who is able to get real-time data on calls within the city of Fresno that they're able to log and be able to provide each morning to a team that would be able to deploy rapidly to the schools, or at least notify the schools of the Handle with Care component. And then if they're in our targeted schools, be able to work specifically to do some screening, monitoring, follow-up, and things of that sort to really mitigate and minimize the impact of trauma within that student. One of the things that we're doing a little differently, which is part of the innovation component is we are looking at how do we also, as we address that particular student's need and trauma, address the family as well. So we're looking at taking the parent cafe model, adapting that to be focused on trauma and trauma informed and also resiliency. I mean, kids are really resilient, and really teaching parents about the resiliency so they can also support their child through that particular process, but also for themselves. Does this give them a way to address the family? Because while the student is the one that gets to handle with care notification at school, if someone is older and not in school or in high school or something older, doesn't mean that they would not have experienced that same event living in that household or that home or that community or neighborhood. So this allows us to slowly try to look at how do we also reduce the impact of trauma on the community. The Handle with Care project is going to be rendered by the Fresno County Superintendent of Schools. They currently provide school-based services through our All for Youth program, which is also an MHSA-funded program. This particular project is going to be rolled out in 2 phases. One phase is going to be identifying 2 schools, and I'm trying to think if I jotted down, and I did not, the schools. It is, I believe, Heaton and Lowell Elementary are our first 2, and then the other ones are going to be Del Mar and Pyle in year 2. We chose those schools for a number of reasons. The Fresno County Superintendent of Schools has clinicians already at 2 of the sites and not at the other 2, so it allows us time to kind of see how that changes. They are close to chaplaincy sites with their current resilience center and the other planned resilience center, but also we really looked at the data and demographics on the schools that had a higher number of students and neighborhoods that had higher poverty rates, that had higher rates of maybe health disparities, and other things that would impact the community and the student. And also what we're going to be looking at is, once we provide these interventions, part of the evaluation, how does that improve both the students' overall academic performance, attendance, wellness, but that also of the school. Do we start to see a change in the climate? We're also really curious to looking at, can this model be something that could be replicated throughout Fresno County? So we'll be piloting it with a total of 4 schools, and the Fresno County Superintendent of Schools will be working with the Fresno Unified School District to try to implement those as part of their current efforts. But we will also look at how can this be done throughout Metro Fresno, how can it be done in Clovis, how can it be done in Sanger, how can it be done in Parlier, how can it be done in Mendota, how can it be done in Huron. So there's some things that we definitely can learn from this process, and so that's what we're going to be looking at. One of the things that also sets this project apart is we're going to have, in addition to the team that's going to be responding, there is going to be peer involvement. And what we mean by this is going to be parent-peer. So parents who have a child that has either experienced some trauma or has engaged in services and care and has been successful, so that they can also relate to and be able to support the families and parents through that, as well as facilitating some components of the parent cafe. I want to say that is probably it with regard to the Handle with Care Plus. If you've got questions, just jot them down on the comment card, email them in, or jot them down. And when we take the questions or public comments, by all means, you can try to ask at that point. I'm going to ask our team who is actually monitoring this if they can correct me and put the 4 schools in the comment. Like I said, I'm almost positive it was Lowell, Heaton, Del Mar, and Pyle Elementary Schools. They are elementary schools we're looking at because, again, for purposes of research, we're trying to make sure that we can handle the information and the flow, and they can verify those schools for us in the message comment section. So real quickly to Brian, how many people do we have checking in on us right now? 12. All right, good. Well, thank you, you 12 who are participating. The last plan that we're working on is Project Ridewell. This one will be about $1.2 million over 3 years, and it's already through an established project we want to do with the Fresno County Economic Opportunities Commission. This came about from addressing a couple of areas. The significant challenges with transportation, which hinders people's access and ability to not get care, but participate in wellness activities and their own recovery. Also, we have issues with, if you're using buses, there's set times, transits and things of that sort. They're not real time. They really require a lot of planning. and there are a lot of limitations in it. So we took some of the requests, and in our last 3-year plan, this was a high area, the need to address transportation for wellness, and in our current CCPs that we've been finishing, the current ones that we're finishing right now also have community plan process has shown transportation to also be a serious barrier and considerate and challenge. So what we're trying to do is go beyond just solving for transportation, because we can't use innovation funding just to solve a need. What we're trying to do is really look at a model of utilizing some type of ride share program, which we're going to be doing with the EOC, developing an app, deploying the app to try to coordinate a ride share like program that can get people to not just their appointments that they have in terms of mental health appointments related to seeing their therapist, psychiatric appointments, but what about all the other things? What about going to a support group? What about going to the park? What about needing to grab groceries? What about all those other things? So we're looking at rolling this program in 2 phases. One phase will be in a rural area. We are doing a triangulation of an area that we can control, because when we talk about rural Fresno County with 6,000 square miles, it's a lot of space. So we're going to try to pilot it out of a Kerman hub for some of the surrounding communities there. And then the second phase will be metro, looking at specific populations within Fresno that we could try to deploy this with and understand. So we're looking at how do we create that transportation support. Now you may ask, why not just use a Uber or a Lyft? There are some limitations in that a lot of times people would have to set up an account for those. They would need to have a way to pay for those through a credit card or a debit card, which they may or may not have. They may not have the financial resources to pay for those services. The other thing that we also looked at is when you get a Uber or a Lyft driver, and nothing against those services, I use them myself a lot, especially out of town, is that you don't have a control as far as who the driver is going to be or what training or knowledge do they have. By working specifically with the EOC and developing the app and providing the transportation project, we're going to be training those drivers on things that would help them provide the transportation in a less stigmatizing and more supportive way. So our intent is to try to utilize some peers, some of our partners, for example, from like NAMI, to provide the training around things like wellness and recovery plans, some mental health 101, mental health first aid, suicide prevention, some of those other types of things for the drivers. So as our drivers are out there and deployed in this project, they will hopefully provide those services in a more knowledgeable and less stigmatizing way. And then lastly, we're going to be trying to look at, for those individuals who utilize these programs, the rideshare programs, do they engage in more wellness activities? And if so, does that engagement actually improve their overall wellness and recovery? So that's just a quick synopsis of that particular program and some of the evaluation. So it's going to have some technology-based efforts as well as some peer components, which we're really excited about. And there's always a possibility that we could eventually have peers identified who can become drivers with the EOC. The EOC has done a great job over the years in terms of training people up, providing people with career paths, working with individuals who maybe have limited work history. And so this also provides another potential opportunity to get our peers involved in our workforce. That is the quick update of those 3 plans. This is the public comment. Thus far, we've only had 1 public comment received, which was for all 3 plans, which was really useful because they didn't send 3 separate emails, which we were able to look at and clean up some of the information. Real quickly, I'm going to jump ahead on one thing, and then I want to come back to the public comment because I want you to be fully aware of this. We have made some changes to the lodge, specifically in the area of what is currently page 14 and page 39 that was related to the RFP. So as we got the RFP and potentially looking at where that would be awarded to, we updated the information in terms of staffing patterns, in terms of the number to be served, in terms of whether or not on page 14, whether the facilities would have to be certified or licensed. The bidders that participated in that bidding process already had identified locations that would have conditional use permits, licensing, things like that, which that means the program could start sooner instead of taken 6 months to get the required permits, things like that. So we went ahead and updated those things. We have not released that updated version yet for two reasons. A, we want to be able to complete the process. We didn't want to keep throwing updates after update, and that's really the main update. And then we also needed to wait for our purchasing department to be able to formally provide intent to awards before we did anything else on that. The plans will eventually have an appendix, which is not completed yet. The appendix is going to include the citations that you've seen in the plans, letters of support. Some of these public comments potentially will be in there in a section that we will create in terms of public comments. So there's things that aren't in there yet, but they don't change the plan. It's just like there's not a cover on the page that if you guys see right now, there'll be a cover. So there's some of those things that'll be part of the final process, but the content for the most part has not been changed with the exception of us going through and really doing editing, formatting, making sure that we're proofing things. If a word didn't make sense or there's, the parts that I wrote are probably got to have a few run-on sentences that we've been cleaning up. So those are really changes, but I wanted to highlight the two main areas that there was some minor changes to were page 14 and page 39 that were related to new information we got through the RFP process that we're going to be including in that plan. And then with that said, I'm going to go back to public comment and any public comment cards. Do you see any questions, Brian?
I haven't seen any.
I think Aaron has addressed a few. I'm trying. Sorry.
15 people on.
Please do not all 15 ask questions at the same time. If this one human care plus will only be pilot with 4 schools, as mentioned, plan key component. The plan partnership is the partnership with the police chaplaincy. Yes, so that's one of the key components is the partnership with that in terms of getting that real-time data and getting that data out for the Handle with Care, and also the parent cafe component. Designing a parent cafe that's really focused on trauma and resiliency. We looked at out there's different parent cafe models. There are ones that focus on different areas, but we didn't have one that is specific on that. So part of this project is going to be also working with the partners in developing what that curriculum is going to look like. As part of look into the capacity in the rural areas. Yeah, so I think there was a question as far as also with the rural communities. The Handle with Care Plus, because it's a pilot, because we're just even trying to look at what would that look like, we are limiting it to 4 schools, and we try to cluster the schools, like I said, based on some great data that we got from both the Fresno Chaplaincy, but as well as the Every Neighborhood Partnership and the Trauma and Resiliency Network. They provided us with some great tips, and so we, not tips, but data that we used in assessing and determining which schools were going to be identified. It was looking at right now, chaplaincy has the real-time data for Fresno, so that was one of the reasons why we've chosen Fresno. If we were to do something with a rapid response, we'll need to work out, in addition with some of our rural communities and partners, how we can get that information from the various local law enforcement in a way that we can timely deploy. So that's the whole purpose of this pilot project, is to really be able to figure out, okay, what works, what doesn't work, and then how can we make this replicated across all of Fresno County. Do I need any other questions? Feel free to post your questions or respond. Or again, if between now and 5 o'clock today, if you have additional thoughts or something pops into your head, as a lot of times it does after this, you still will have the opportunity to use the public comment cards on our website, submit those to the MHSA email, but after 5 o'clock, we will stop with all public comment. And the next time we would be able to take any of that would be at a possible hearing with our behavioral health board, which is something that still has to be discussed and planned. But this would be, as far as the general public comment, these would be the last part. So we're allowing people for the next few hours after this session to submit their public comment cards so that we can take those and include those into our final write-ups as well. How many do we have on there?
Not seeing anything. Yeah, 15.
So just to, as we wait for any additional comments, I'm gonna go to like our last slide. So the next steps, we're completing this public hearing. We do need to have our local behavioral health board review the plan and give us the thumbs up. And the governor has provided a lot of leeway in terms of how counties and just local boards, commissions, and things like that can meet. So that's going to be some discussion we'll have. We do need to try to get this to the OAC by April 10th, as I mentioned earlier, and to be part of the OAC meeting in May. As of right now, there's, I think, 8 to 11 counties that have plans for May, and a lot of it is because they're plans that are subject to reversion, and so they're trying to get those in. The MHAOC commission usually goes dark in June. In light of the fact that they had to cancel their last hearing last month, more than likely canceling this one here in April, and that there may be a backlog of plans coming in that need to be done, that counties have run into some barriers in terms of completing those as a result of our current COVID-19 pandemic emergency and some of the emergency declarations, that they may do a special session in June to catch up on those. But as of right now, Fresno should be going up in May as soon as we can complete these steps. Once the funds are secured for the project or approved by the OAC, they will not revert. They're basically encumbered, and the clock does not start on those funds once approved until we start spending the first dollar. So if it doesn't make sense at the start of the new fiscal year for us to go live with some of these programs day one, because of still maybe experiencing some of the ramifications and repercussions and ripple effect from the COVID-19 pandemic, we do have the option to decide when we're going to roll that out. But the money to fund those projects will be secure and safe, which is really the important thing, because these are programs that stakeholders have asked and have really wanted to see come to fruition. And we're excited about, because I think it helps address some really interesting, it allows us to really answer some interesting questions. And how do we solve for some of these problems in a way that also are going to be contributing to how we can do things better in the future. So that's kind of that part in there. While we're waiting for any other additional questions, I do want to, and I just touched my face. I have hand sanitizer, so it's okay. What we're going to be doing is processing any public comments and feedback we get, and really working on finalizing the plan. Like I said, you're not going to see changes to the content and the scope. What you're going to see is edited versions of what we have, which we didn't note when we put those out there that those were drafts, that we still needed to do some cleanup and just making sure we plug those in. Some of you out there as community partners may be getting requests from us to complete letters of support. We understand it's a very short window. We could not send those out till after we completed our 30-day public comment, so we can send some of those out today. We do need to submit these by Friday, so it's a short window, but we will send those out to some of our community partners and ask if you have time and you're able to put that onto your letterhead, sign those if you could, and send us back those scan and send those back to us, and we can try to include those in a plan. If not, when we do get ready to formally present, whether it'll be through a teleconference or some other way to the OAC, we can also submit some of those letters of support at that time as well. Remind everyone that if you go to the Fresno County Department of Behavioral Health homepage on the county website, we have a slew of resources on there right now related to COVID-19. We've got infographics with a lot of info and tips. We've got some mindfulness technique videos. We've got some real-time information on services out there. As of yesterday, we posted some additional information on our warm line in Spanish and Hmong. And the warm line, for those of you guys, it's 559-600 WARM. I would have to look on my phone to see what letters. 9276. Brian's done a lot of work on those flyers, so he has that number memorized. The staff that are manning those are excellent. They're trained. They have a lot of resources. They're there to provide that emotional support and listen to people. So please feel free, go on there, take any of those documents, PDFs, videos, download them, share them, use them however you may. And then also check on our Facebook page, where we'll have, where we keep trying to post and update our resources and information as well. Any other questions? I see there's a note there from Brooke France. Hey, Brooke. Acknowledging that Fresno Chaplaincy does have some great real-time data. They do. We were able to pull some really great data for this project, the Handle with Care, through the Trauma and Resiliency Network and some of the partners that have helped every neighborhood and some ideas. And we hopefully will be able to consult with them in developing maybe the curriculum for the Parent Cafe. I know Artie and Brian over there have some really great ideas in trauma-informed care and techniques and things like that. So before we had to go on shelter in place, I had even ran into Brian at a community event, and he dropped some great ideas of like, here's a book and here's this person doing this on trauma-informed care. And so those are all things we're going to research, look at, and really try to bring in maybe some community input and partners in helping us shape that component, because that's going to be the part that's different. And I know from talking with the state, they were really interested in seeing how that Parent Cafe component can impact these Handle with Care type models, because there are a few. There's one in Stanislaus or San Joaquin, Stanislaus, I think, Placer, several other ones that don't have this component yet. And this could be a great addition to doing trauma work, not just the Handle with Care, but trauma work in general. I'm going to give it about another minute or so. If there's no other questions at that point, we'll go ahead and conclude our public hearing related to our 3 innovation plans. Again, those are on their website. What we will do is once we submit the finalized, or at least our version of finalized plans to the OAC at the end of next week, we'll post those updated ones in there so you can see the full thing that goes out to the OAC. And then once the OAC sets the agenda and the calendar, those plans will also be listed on their website in full as well. So they'll have to get it and start reviewing and make sure that we've completed all the things that we're required to do. I'm trying to think of anything else that might be relevant to this.
Not seeing anything else. 16 people.
All right. Hey, that's like way more than a couple of our CCPs we had. I kid. Oh, just an update for those of you guys that might be interested. We have suspended work on our MHSA 3-year plan, the new 3-year plan. Not that it won't happen, but right now with everything that's going on, there's been a lot of challenges for us to be able to move that forward. Also looking at that 3-year plan and what will be some impacts in terms of financially and what will be feasible. So we are looking at that still and waiting for the emergency to pass. And so that we can start looking at that. What the state has said is with those MHSA 3-year plans, they are waiving deadlines for annual reports, for the updates. They suggested that counties just continue to operate off their existing plans until they're able to work on their new 3-year plans. So that it's not that we haven't done it, but we were pretty far along in writing it, and then everything happened, and so we've got those on hold. Those they gave us some exemptions on and waivers. What they were not able to do was with these innovation plans. And the reversion that they said, we learned last week, that would not be something that the state at this time could do, because that was driven by legislation in AB 114 that required the legislature to change that requirement of plans be approved by the June 30th, 2020 or be subject to reversion. Legislature is currently on leave. They're not in session, so when they come into session, they're going to be tackling a lot of emergency things, so this may not get done in time, and that is why we're moving forward, as the OAC had also recommended for counties move forward with their innovation plans, because there's no guarantee that we would get an exemption, and we don't want to have this money revert back. We really want this money and these projects to occur here in Fresno County. So I see a comment in there from Chris that they are glad to support from NAMI Fresno. Don't worry, I will be sending you some requests shortly. So you'll be getting some of those ways that you guys can support as well. If there's no other questions, I just want to remind everyone, check our website and Facebook for resources. Please practice social distancing, stay safe, stay clean, stay home unless you really need to be out and about. Let's get through this so we can get back to business as usual. Well, the new usual, which is really providing services and working with our great partners out there. So with that said, thank you very much. And you've got till 5 o'clock to submit any last minute public comment cards, ideas, or suggestions. Thank you.